Infertility can be a difficult conversation, but it's an important one to have, especially if you're looking into services. Here to talk more about this hot topic and reproductive options, we have Dr. Lucy Chen, and we're so glad to have you here. You know, I feel like in the news, we've talked a lot about infertility. It's come up a lot, especially as we're getting closer to the election. Can you talk about some of the maybe common misconceptions you've heard or concerns you've gotten from patients based on all of this news that we've been consuming surrounding infertility?
Yeah, absolutely. Definitely reproductive rights and reproductive access to fertility treatments have been a hot topic, especially this year on the national stage. I think not so much misconceptions, but more of the number one concern patients have is, what are the limitations for reproductive access for the state of Virginia? And currently in Virginia, we luckily do not have any restrictions on reproductive care, IVF access, and so that is definitely something that I want to reassure patients on. Of course, if they have valid concerns about the process of IVF and their embryos, I always encourage them to go call their doctor, talk to them, ask their fertility clinic. It's our job as your fertility doctor to be up to date on current laws and politics so that we can reassure you and help you make a well-informed decision.
Now, because this is such a sensitive topic and, it's not commonly discussed, I feel like sometimes people or even couples are having trouble conceiving and they're not really sure when it's time to talk to a fertility specialist. When do you suggest someone should contact your office to find out more information?
That's a great question. So generally, we say that for couples where the woman's age is less than 35, they can try on their own for about 12 months before it's time to say, you know what, something's not going right, let's get some help. For women 35 and older, it's a little bit of a shorter time frame. So after 6 months of trying without success, it's time to come in. However, at any given time, I never tell a patient to wait. If you feel like you need information, whether you've even started trying or not, it's always good to be informed about your reproductive potential. So come in, talk to us. We'll, go through your hormones, go through your imaging, and try to give you some answers.
So either way, you can learn a lot of things about what's going on with your body specifically.
Exactly, yes.
So let's talk about this. We were mentioning this during the commercial break as well, just kind of going through some things so people can understand what their options are. We were talking about IVF versus IUI. These are two different services. Can you kind of quickly explain the difference between the two?
Yes. So IUI and IVF are both two different types of fertility treatments, but they're very different. IUI, or intrauterine insemination, is a much low invasive and relatively lower cost fertility treatment option. It involves taking semen from a male partner, washing and processing it in the lab to remove debris and dead sperm, and concentrating only the best sperm from that collection. That's then inserted into the woman's uterus when she's ovulating, and that places the sperm as close to the fallopian tubes as possible. The goal here is we're trying to facilitate and increase the odds of fertilization. IVF, or in vitro fertilization, involves a woman taking hormonal medications for about 10 days in order to stimulate and grow as many eggs as possible in her ovary for that month. Then after 10 days, she undergoes a minor surgical procedure to retrieve those eggs out of her body. And the eggs are combined with sperm in a highly specialized lab to create embryos. And the embryos are then transferred back into her uterus with hopes that there will be a healthy pregnancy. Now, any remaining embryos can then be frozen for future use in case the patient wants to come back and expand her family. Both of these treatment options have pros and cons, but they are very different. In the right patient population, IUI is a great alternative, but sometimes IVF is currently our most effective treatment method.
There's a lot to certainly consider if you're interested in fertility treatments. Make sure you reach out to Dr. Chen. Really quickly, we have to go. How can people contact you?
So we are at CCRM in Virginia Beach. You can contact us at any time. We'll be happy to take care of you.
Fantastic. Thank you so much for just kind of bringing this knowledge to us. And again, if you're interested, certainly reach out to Dr. Chen. We'll be right back.